Hello, everyone, and thank you for coming to our webinar, Fibroids Are a Whole Person Issue. I'm Sibylla Moody, and I want to thank Healthy Women for inviting me to host this very important event. I really enjoy working and partnering with healthy women through my podcast, Great Girlfriends, which connects women with daily solutions and tips for living a passionate, everyday life, and talking about various health topics that affect women, such as what we're going to do today on the topic of uterine fibroids. But first, I'd like to thank Intuitive, Myovant Sciences, and Pfizer for their support of today's webinar. Thank you so much for making this event possible. Now, you may be asking, why is this webinar so important? Well, I'm here to tell you. Consider this. Up to 80% of women have fibroids by the age of 50. And although not all women experience symptoms, it is important to know how living with fibroids impacts many women's overall health and what different options are available for management and treatment. And we have the perfect, and I say perfect, lineup of guests to help us better understand the impact of fibroids and what women can do to best manage their health. I'm so excited to introduce this esteemed panel of guests. So let's get right into it. First is Dr. Tiffany Jackson, who is a board certified OBGYN physician specializing in gynecology and advanced minimally invasive gynecologic surgeries. She educates physicians in various surgical techniques, researches its clinical outcomes, and performs robotic and laparoscopic surgery in her fibroids patients. Dr. Jackson is passionate about finding the best solutions for and treating uterine fibroids. Welcome, Dr. Jackson.
Thanks so much for having me. I'm really excited to be here today.
It is our absolute pleasure. And next, we have Dr. John Lipman, who is a board certified interventional radiologist and renowned authority in the non surgical treatment of uterine fibroids. He is the founder and medical director of the Atlanta Fibroid Center and has cared for women from all over the world. He was awarded the highly acclaimed fellowship status in both American College of Radiology and Society of Interventional Radiology, honors that only less than 10% of radiologists ever achieve in their career. Thank you, Dr. Lipman, for being here.
Thank you. It's my pleasure. Thanks for having me.
We are so excited to hear from you. And last but certainly not least, we have our patient, Candy Ramirez Hale. Candy is an urgent care triage nurse from Oakland, California, and has been living with fibroids since first being diagnosed in 2007. She is passionate about patient advocacy due to her own personal journey with uterine fibroids and fertility. Thank you, Candy, for your willingness to share your story.
Thank you so much for having me.
Oh, we're so pleasured. So I want to jump right in, and I want to start with you, Candy. Can you just share a little bit with us about your story, about your symptoms, if you had any, and how uterine fibroids have affected you?
Yes, thank you so much. So I was, as you said, I was diagnosed with uterine fibroids in 2007. So that's when I was 20. And I didn't really start having very severe symptoms until my 30s. They've affected many aspects of my life, mostly my physical health. They've made my periods just very, very heavy and painful as well. And I've also developed chronic pelvic pain. Unfortunately, I don't think we're taught as teenagers and then into our 20s what a regular period is supposed to be like. And so I thought that it was normal to bleed, 7+ days and to soak through extra large pads and to use multiple period products when I was on my period. And then in my 30s, I actually had several emergency room visits due to severe pelvic pain and did have to get 2 blood transfusions due to the severe blood loss that I was experiencing. Another thing that I don't think many people with fibroids talk about, I think due to maybe shame and stigma, is urinary incontinence. For many years, I blamed myself and thought that it was just that my pelvic floor was weak, and I didn't realize that it was connected to having uterine fibroids. And sex is another topic that I don't think we discuss often when it comes to fibroids, but fibroids can make certain positions when you're having sex painful or uncomfortable. And when you're bleeding so many days of your cycle, it can also be challenging to, feel like having sex.
Mm-hmm.
And also, my abdomen is pretty distended, and often people ask me if I'm pregnant, which can be really uncomfortable and, just causes a lot of awkwardness in how my body looks.
Mhm.
Um, Financially, it's also taken a toll. As I said, like I had to buy so many different products and try different things that worked for me. I would have to layer on products, so using pads and tampons and period underwear, which was just really challenging. Also, spending a lot on things for pain, so taking a lot of ibuprofen and heating pads and all of these different things to really try to make myself comfortable when I was having my period. And I think it really affected my productivity at work. And I also missed school days when I was in college due to my heavy periods that I was having. And I also had to seek providers outside of my insurance, which was really expensive and, impacted my financial well-being. And I think most importantly, it's really taken a toll on my mental health. I'm
Mhm.
fortunate that I have a great therapist that I've have a relationship with and has really helped me to cope with the symptoms and the impact this has had on my life. But it is really challenging to feel like there's something wrong with your body, and that my overall health and fertility are different. So it's been kind of a roller coaster in that sense.
Can I rewind just a bit to find out how you knew or how you discovered that you had fibroids?
Sure. Sure.
Mhm.
So I was diagnosed with fibroids during a routine pelvic exam,
Mm.
and then they sent me to get an ultrasound and to confirm that I did have it. So, and then after that, I think because of, I think a lot of people have challenges with access to care.
Mhm.
I kind of fell through for a bit there after I graduated college and didn't have really good follow up, and that I think that also impacted the care that I received.
Okay. So Dr. Jackson, excuse me, or Dr. Lippman, is there anything you want to add around what you've seen in terms of how fibroids affects your patients or, like Candy mentioned, affecting finances, even sexual relationships? That's very new for me to hear, Candy. So first, I have to thank you for that transparency of hearing how it affects your romantic life and even your ability to be productive at work and mental health. Anything that you have seen or have noted with your patients?
Well, she describes the typical patient that we see every day. They may discover it early, like she did in the 20s, but not getting symptoms that are really significant till some years later. Um, and she describes the three main symptoms: heavy periods, pelvic pain, urinary frequency,
Mhm.
also pain with intercourse, as she mentioned. Plus, when you're bleeding to the degree that she was bleeding, let's face it, sex is exercise. And so a lot of these patients are anemic, they're tired, they're fatigued, that,
Mhm.
sex goes out the window. Plus, when you're bleeding is to the degree that she was, you're wearing all this extra gear and diapers and period panties or what have you. You don't feel very sexual. And so
Mhm.
that's where treating the fibroids can give you your sexual life back as well as your overall health back. So that's really important. She describes she's a very typical patient. This is not somebody that you wouldn't see pretty much every day in a GYN practice or in our practice at the Fibroid Center.
Mhm. Mhm.
Yeah, I agree. And thank you, Candy, so much for sharing that story because I know it takes a lot to kind of share those details of your life. And that's what I find with women every day is that they've been suffering for a while before they actually come in for treatment and
Mhm.
really just have come to believe that that's just a part of being a woman and the suffering. And
Right.
unfortunately, women kind of will direct their lives around their fibroids. They miss social events when they're on their period, they miss days from work and actually sometimes have their jobs in jeopardy because they've had to miss days for treatment or, ER visits, that type of thing.
Mhm.
So it's just a pleasure when women are able to come in finally and get educated about the options for treatment to help improve their quality of life.
Mhm.
And a
Mhm.
lot of physicians don't recognize what is normal and abnormal from a period. Same with, as Candy said, she wasn't sure that what she was bleeding was not normal.
Mhm.
Because when somebody is bleeding for that long, they just feel like that's their normal, which it's not normal at all, what she was describing.
Mm.
And sometimes you go to the most trusted source which would be your mom. And unfortunately, mom had fibroids too and bled the same way. And so
Mhm.
mom may say, well, we're just heavy bleeders. That's like what I
Mhm.
did. That's what you're going to do. And it's not normal. And then even physicians often won't treat, well, they may first say, are you bleeding normal or abnormal? And of course, the patient says, well, I think I'm normal. And they don't go any further to understand, to really dig deeper and to find out how many pads are you using? Are you using 2 at a time? Are you soiling clothes or bleeding through clothes or linens? Are you afraid to go to your girlfriend's house? Or, the things that Dr. Jackson described, is your life affected? And everything about these patients, their whole lives, whether they do work or not, relations or not, everything revolves around this abnormal period. So I cut to the chase because a lot of doctors will describe, this is how many cc's of blood is normal for a period. And that's just impractical. Or they have pictures of sanitary products, the PBAC scores. It's impractical. What's very simple is if you're bleeding such that it's interfering with your quality of life, no matter what doctor tells you, it's not normal and needs to be investigated.
I want to celebrate everything that you all just said, and Dr. Lipman specifically because as women, and you do have that generational context of that we're heavy bleeders, and that is something you hear frequently between girlfriends. And then when you say normal, just to be so candid and honest in our very safe space here, we're not comparing pads to go, well, this is how much I bled and this is how much you bleed. So there is no real measure or indicator. And I do like what you said, which is for every woman to know that if your quality of life has been affected, that is so key to understand. It is not that our quality of life should not be affected by this, because that's not something I knew. We are, I think we are raised to think that your quality of life will be affected by your cycle, that you will soil through things, that you will have these moments. I mean, that I'm just going to say that was my story. So you're kind of setting me free today. And I know so many women who also have that sentiment that it just comes with the territory. And but I'm hearing you say that it is indicative that there is something that needs to be investigated.
And if you feel that, when you go to your doctor, and if you feel you're not being listened to or they're dismissing your symptoms, find another doctor. That's really important. You've got to kind of be your own health advocate, and really nobody knows your body better than you.
Yeah.
And so you're the expert on your body.
Hmm. So good. So we know Candy had the symptoms, right? But we also know that many women don't have any symptoms, but others are very significantly affected, as Candy was. And when thinking of management or treatment of fibroids, many people believe that a hysterectomy or the partial or full removal of the uterus is the only option. And so you have that as one option, or some women will wait until menopause when fibroids often shrink or disappear. But today we have more options and we need to know about them. And so many women are taking notes right now because there's so much right here that is going to really help and give them power to take control of their bodies. So I want to ask if you can share what other options are available for managing fibroids. And Dr. Lippman, I want to start with you. If you could, please discuss with us some of the medical and non-surgical options.
Well, oftentimes when patients will come to our center, we'll talk about the symptoms and so forth, and imaging, and make sure that their fibroids are symptomatic. And once they're symptomatic, then we talk about what are some of the ways that we could help you. Oftentimes, patients will be already on medical therapy, which might consist of a non-steroidal anti-inflammatory medicine like ibuprofen, or a specific one that affects the lining called tranexamic acid. They're okay. Or they may be on birth control, whether it's a oral birth control product or a progestin-containing IUD like a Mirena. They may be on some sort of hormonal product. One of the best therapies is called uterine fibroid embolization. It is completely non-surgical, no surgery at all, outpatient 30-minute procedure. Patients get all of the fibroids treated, not, every single one, whether they're big or small, how many they have, it doesn't matter size or number, all of them get treated. And so the success rate is very high, 90% success for an outpatient procedure where you're going home the same day. with a Band-Aid and all of your parts. And it's
Mm.
covered by every insurance. We've been doing UFE here in Atlanta for the past 25 years. So it has a long track record of being safe and effective. And that's an outstanding therapy. And it's really replaced a lot of the watchful waiting that people, you mentioned, well, I'll just wait till menopause.
Mhm.
You really don't have to do that. You don't have to have your quality of life impacted every day when you have such an outstanding non-surgical approach available to you.
Mm. Well, that is so, so good. And how long is the recovery time typically? I know you said it's
Yeah.
outpatient. Is
It's outpatient. Patients go home after several hours of recovery with a Band-Aid, and the recovery at home is about 5 days. So I tell patients, kind of see, but we'll have patients go back within 2 or 3 days, particularly if they're working from home. A lot of people work from home these days. So by day 2, day 3, they're working from home. But the typical recovery is in that 5 to 7 day range.
Hmm.
But it's a much quicker recovery because there is no surgery.
Mhm, mhm. Thank you for sharing that. Well, we do know that sometimes surgical options are warranted, and so we definitely wanna make sure we're sharing those options, and walking through them so that, women really understand, where they can weigh those options. So, Dr. Jackson, I wanna point to you and ask you about those, surgical options, and I wanna learn a little bit about how long it takes to recover from fibroid surgery, and how do you determine the best modality to use?
Yeah, thank you so much. So, there are lots of options besides hysterectomy to treat uterine fibroids. And so that's actually why a lot of women seek me out because that's all they've been offered. And so I find it my job to make sure that patients are presented with all of their options. And then together we partner based upon their symptoms and what their goals are to decide what's best for them. So although I do focus on minimally invasive surgery for some of my patients, that is still medication. But more specifically with the surgeries that we offer to treat uterine fibroids, you have radio frequency ablation of fibroids that we do transcervically or laparoscopically. Again, those are outpatient procedures with a recovery of 24 to 48 hours.
Mm.
We have the myomectomy procedure, which I preferentially perform with robot-assisted laparoscopy.
Okay.
More specifically, that's the procedure where we go in and we actually cut the fibroid out, but we preserve the uterus so that for the women who are still interested in getting pregnant, they can still have that option open for them. Or for the women, for their own personal reasons who want to preserve their uterus, still have their uterus preserved. So that's actually also an outpatient procedure. With the robot assisted laparoscopy, they end up with 1 centimeter incisions, the width of my finger here,
Mhm.
and they will have a same day discharge. That recovery is approximately 1 to 2 weeks with return to activities of daily living. So women are not down long. And with a lot of patients working from home now, they find themselves, depending on the situation, being able to take off a few days before they're able to return to work from home. And then, of course, for those patients who do still want a hysterectomy or that still ends up being, the best solution for them that we've come to together. That is also still performed with robot-assisted laparoscopy with the small incisions. Again, a same-day discharge, 1 to 2 weeks with return to activities of daily living. The distinction being the restriction period, having restrictions of about 6 to 8 weeks of no sex, no strenuous exercise, no strenuous physical activity. So it's important when you are looking for a surgeon to make sure that they can offer you those minimally invasive techniques. So everyone kind of sometimes frowns about when they hear about having surgery because they've heard about the surgery that their mother had or their grandmother had where they're in the hospital and laid up for 6 weeks. And,
Yeah.
that is just not what has to happen today. So the myomectomy procedure can be done traditional open with a C-section scar or a vertical scar with conventional laparoscopy or robot-assisted laparoscopy. So in my hands, the robot-assisted laparoscopy is the preferred kind of treatment choice to give patients the quickest recovery and the best results.
And for those, 3 options that you mentioned that are surgical, Are there any that are better for a woman within a specific age range? I heard you mention, like, for example, women who want to, preserve their uterus, and or you may have women who are, in their early 20s who are, at the beginning of their life, or you may have women who are in their latter stages who are past childbearing years or interests. So, are there any that are specific to age?
Yeah, so that's a great point. I think probably the first question to ask is, what are your fertility plans? And
Okay.
so if that question is, I don't know, or I
Mhm.
like to keep that option open, then you want to make sure that you're offering a procedure that will best allow that option to be maintained open. And so that's actually probably what I see patients most for are women who are, perhaps on what many doctors would consider, the end of their childbearing years,
Mhm.
and they've only been offered a hysterectomy.
Mhm.
But in my hands, appreciating that desire to keep fertility open, even to the latter years of your reproductive time period, and offering a myomectomy procedure. So I'll kind of
Mhm.
use myself as an example.
Mhm.
I actually am a robotic surgery fibroid patient
Oh,
about 10 years ago, and am expecting my first child now in my 40s.
oh,
Um,
Great.
congratulations.
Congratulations.
Yes.
Thank you.
Excellent.
And so many women, especially in today's culture, are delaying childbearing,
Mhm.
or, for whatever reasons, they focused on their careers and it just hasn't happened yet. And that's just not quite a chapter that they're ready to close. And so being able to offer them a myomectomy instead of a hysterectomy is
Mhm.
huge.
Mhm.
And to be able to offer it in a minimally invasive fashion, again, such
Mhm.
that it's not, taking them away from their lives
Mhm.
longer than it needs to. So the first question I always want to know
But
are,
this
what are your
option was
fertility?
available 10 years ago. So I'm understanding this option was available 10 years ago, and aren't we grateful that you were able to take advantage of it
Yes,
for yes.
absolutely.
Yeah.
And so, when you're talking to your doctor, if they're not able to offer it to you, as Dr. Lipman mentioned before, find another doctor, because there are
Mhm.
doctors who are offering minimally invasive surgery. And so, you just want to make sure that you're with a provider that, is going to be able to offer you
Right.
all of the options to, help achieve your goals.
Mhm.
Um, and then outside of fertility, also just, asking patients, what are your goals? For some women, they're fine having periods. They just want them to be more manageable. They
Mhm.
want them to be lighter. Some women, they never want to bleed again.
Okay.
So really understanding, what their goals are, what do they have in terms of availability to take off for time for work, in terms of their family demands, work demands, because that's very real.
Mhm.
Patients sometimes will want, a myomectomy or hysterectomy, but the reality is they can't even afford 1 to 2 weeks off of work.
Mhm.
So, again, it's really about partnering with the patient, finding out what their goals are, and working together to um, provide them with the best treatment plan.
Mhm. That is
Yeah,
so
I'd like to
helpful.
echo
Yes,
that too. Working together, I mean, obviously, we have different skill sets. As an interventional radiologist, we have certain skill sets and do certain procedures to help women with fibroids. The gynecologists have certain skill sets to do other therapies. And working together, we work very closely with gynecology. Um, Unfortunately, even in a big metropolitan area, I'm in Atlanta,
Mhm.
most hysterectomies are still done open, and not with these less invasive surgical techniques.
Mhm.
So it can be hard to find somebody as expert as Dr. Jackson in Atlanta. But working together is really important to provide the most options and to really give the patients the most informed decision is really critical. The
Mhm.
other point that you would mention about the uterus, I mean, I hear this every day. Patients telling me, "Well, my doctor said because I'm not interested in fertility, I don't need my uterus anymore," and that's just absurd.
Mhm.
Um, there are a lot of side effects for women that undergo hysterectomy, particularly given the fact that the average age of hysterectomy in this country is less than 40. And that's really sad. These are young women. And I've met way too many women in my 30 plus year career. Less than 30 have already had a hysterectomy for fibroids. They weren't given any other option. And that's absolutely tragic because
Mhm.
even with UFE, we've had 60% of our patients, and we see our patients are typically 35 to 45. the older, as you mentioned earlier, for fertility, 60% of patients that wanted children got children with UFE, which is really remarkable given the fact that most of our patients are in that 35 to 45 range with diminished fertility, and some of them have already had previous surgeries for fibroids. So, and our births are typically full term and vaginal, which is very nice. Some women want to have a vaginal birth. That's where bringing all the different physicians' skill sets to bear and providing as many options as possible, giving the patients the pros and the cons. We all have our skill sets and can make the best for our patients.
Thank you so much for sharing that. I want to point to you, Candy, because we've talked about the options, surgical and non-surgical, and I want to get a sense of what your experience was like. So how did you make your decisions regarding your treatment plan? And did you feel like it was a shared decision with you and your healthcare provider, or did you feel like you were forced into a decision?
So I think it's really important, as Dr. Jackson mentioned, to have like clarity on what your fertility goals are. I think when it comes to reproductive health and reproductive organs, I acknowledge that it can be really hard depending on where people are in their life, but getting some kind of clarity, or maybe having the possibility still be open to you, can really help guide your decisions. I was really sick when I made the decision to have a procedure, and I think that in that way it was a bit rushed. And for me, it was also really important to have a vaginal birth at that time. And it's tricky because hindsight is 2020. And so I think at the time I made the best decision with the tools that I had, which is, I think, what most of us can do. But I wish that I would have consulted with more providers and more specialists before making a decision. And I really would encourage people, when they get diagnosed with fibroids, to seek, consultations from fibroid specialists, and to get different options from people, hopefully before their health is greatly impacted, and also, if insurance and finances allow, to really seek out a provider that they trust. I think that there's like a gut feeling and a safety that comes from being with a provider that you feel heard, where they're really explaining all the things to you, and you definitely don't get that with everyone. So I think it's and it just makes your decision, whatever it is that you make, it makes it sit better in with you later on. So I think it's if at all, like, to just really look for different providers, because not every provider will be like the right one for you.
That's so good, Candy, because we do know that healthcare is not one size fits all. And so it's important that our healthcare providers really take a personal or custom or tailored approach to how they treat each patient. For you, Dr. Jackson, how do you approach patient care and the decision making when it comes to treatment options? So, we really want to know and understand, what do women need to be sure they're making the best decision, and how do you understand what is best for your patient?
Well, I agree with what Candy said. And I think the first thing is seeing a provider who listens. So if I'm meeting you for the first time, I just want to hear everything you have to say. I want you to talk to me, and without interrupting you, tell me everything that you want to tell me about what's going on. And then I can start asking questions. And, frankly, just ask you, what do you want better? What do you want to achieve? And then with that, moving forward and presenting all the options, the pros and the cons, and, deciding together how to best achieve that. Some patients want more of the influence from the physician than others, and that's totally acceptable, as long as we both agree that moving forward with a certain treatment plan is good. So it really is an individual patient by patient discussion and partnership. So it's hard to say, this is what we do in this situation, because, every patient is different. So I have some patients who walk into my office, and the first thing they want to tell me and make sure I know is they do not want a hysterectomy. So, okay, great. We're not even going to really talk about that or mention that. Or some patients walk in and say, I want a hysterectomy. I was like, okay, well, let's back up. let's find out what's going on and see if that's what we actually need to do here.
Mhm.
So again, it's about listening and understanding what the patient is experiencing, and then educating them about their options and working together to move forward. And some of the key factors that I would look into are, what are your goals for your bleeding? What kind of time do you have to take off to have a procedure? What is your support system like? And what are you wanting life to look like after this is over? Uh,
Mhm.
so together with all those things, we can decide, hey, do we want to do a radiofrequency ablation procedure, a myomectomy, or hysterectomy? But it's a decision, most importantly, that we make together.
Mhm. Are the cost factors an influence there too, just in terms of patients' ability to manage cost or, you know?
Absolutely, and that's very, very, very real. A
Mhm.
lot of patients don't necessarily have a great understanding of how insurance works because, for the most part, they've been relatively healthy, maybe outside of this fibroid issue. So, as much as information that I do have available at the moment of the visit, I know a lot of physicians don't like to kind of get into the finances of treatment, but within the information that I do have about their, insurance with their insurance card, that type of thing, I'm more than happy to explain deductibles and co-insurance and give them kind of a brief estimate based upon the limited information I do have at that moment about what that entails. And so people right then and there sometimes make a different decision that,
Mhm.
hey, maybe they're going to try a Mirena IUD for a while before they go through with the procedure until they're in a better financial position, or, until they are able to take time off work and be able to afford some time off work. So I'm
Mhm.
very upfront with that because I appreciate that is a factor.
Mhm.
So,
Mhm.
um, and it can't be ignored.
And we know for a fact that there are barriers to care and access for women nationwide, including insurance, cost, accessible providers, lack of information, bias, or misconception. So, have you seen or experienced any of these barriers in your own practice? I want to start with you, Dr. Jackson, and then point to you, Dr. Lippman.
Absolutely. I think there's definitely barriers in access to care and access to, again, physicians that can provide the full spectrum of opportunities. Many times when I'm seeing patients, I'm the second or third gynecologist that they sought,
Mhm.
or, they're just saying, wow, I wish I had found you, 5 years ago,
Mhm.
because they just haven't necessarily gotten presented with, all of the treatment options that are available to them,
Mhm.
or even just being able to see someone that focuses exclusively on gynecologic surgery, that they've, been in OBGYN offices where maybe the focus is more on obstetrics. And so finding someone that really wants to focus on, the treatment of their fibroids and possibly their surgical needs.
Mhm.
And then I think sometimes having uh, just what Candy mentioned previously, the stigma of fibroids.
Mhm.
Um, just as I openly kind of shared my own story, I share with my patients as well. So appreciating that, fibroids are common and a lot of women are dealing with this. And, there is life ahead and it
Yeah.
can be good. And so being open and forthcoming about my own story with patients, I think has been helpful, and normal, helping women to appreciate that what they're going through is, not unique and that there are options. Um, I think has been important in
Mhm.
taking down some of those barriers to
Mhm.
care, or even, seeking help moving forward.
Mhm. And Dr. Lippman, for you, do you think there is, or what do you do to help women overcome these barriers in your practice?
There really is very little discussion on the preventative stuff. Nobody knows where fibroids come from. We know that they grow with estrogen, but there's been very little research into
Mm.
fibroids, and that's wrong. I mean, if you look and you want to talk about a racial disparity, of which obviously there are many, but one with dealing with fibroids that if you look at the research dollars spent on fibroids, it's very small. It's in the fact
Mhm.
fibroids ranks in the bottom 50 of 300 medical conditions. It gets about 69 cents per person affected, versus you take a condition, cystic fibrosis, which affects primarily Caucasians,
Mhm.
it gets $3,000 per person affected. And
Wow.
the cost to society for fibroids is way more than the cost to society for cystic fibrosis. But so you have, on one hand, a condition that affects primarily African American women getting 69 cents a patient in research funding versus something that affects Caucasians getting $3,000. And again, much less impact to society. So
Mhm.
there is a very important bill in the House and the Senate, the Stephanie Tubbs Jones Fibroid Research and Education Act.
Mhm.
It was started by Representative Stephanie Tubbs Jones, who suffered with fibroids, but unfortunately passed away
Mhm.
before she could see this legislation become law. It directs the NIH $50 million a year for the next 5 years. I'm sorry, $30 million a year for the next 5 years in research funding. Plus, it directs the CDC to educate not only doctors, but also the lay community on these other options besides hysterectomy for fibroids. So it's very important research. Cory Booker is pushing it on the Senate side, Representative Clark out of New York from the House side, but it's just sitting there. And it's really, this shouldn't be a partisan issue. I mean, both sides should be able to agree
Mhm.
this is what we need and get it done.
Absolutely, absolutely. Thank you so much for citing those political ramifications. I mean, that is something that we experience on the patient side of things, but to understand on the back end some of the policy that needs to be influenced in that area is so helpful. Candy, I want to know from you as a patient who is, now you're working as an advocate, and thank you so much for turning your story into a story of power where you now are advocating. What do you think women can do to advocate for themselves to get the care that they need?
Yes, I love this question. I think, especially as a woman of color, often in medical care, our needs get dismissed, and I think it's so important to find providers that are really listening to what your concerns are, what's important to you. And I have a few strategies. The first one is write things down. Take a notepad to your doctor's office. I'm still not like great at this, but I think having questions ahead of time, making notes about like what's been going on with you, and taking notes during your appointment can be really helpful. And now that like most of us have access to our medical records electronically, checking the notes written about your visit and making sure that they kind of correlate with what actually happened, because you can actually have, ask for the record to be changed if it doesn't match what you experienced.
Mhm.
And to that point, my second recommendation is, if you find that a provider is not listening to what you're requesting, you can always find a new provider, but sometimes people are limited by insurance and, their financial situation. And so, if you have a provider that continues to refuse a treatment, it's important to let them know, hey, can you make a note in my chart that you're refusing this treatment? For example, if you're asking them to order an ultrasound and they're refusing, you can say, I would like for you to put in my chart that you're refusing to order an ultrasound, because that is part of your right as a patient. And I think it's just, yeah, I think it's really important to stand in your power. I know Dr. Lippman mentioned it earlier, but you live in your body 24/7. So you're an expert in your body, and providers are, consultants, right? They have more knowledge on how the body works, and this means that they're going to offer you suggestions, and it's up to you to make the decisions about your body.
Mhm.
And if you don't like the options that they're offering, then seek out another provider and another option, because you have the final say. And finally, find support. I think living with fibroids can be so isolating and you feel like it's just happening to you. I found so much information on social media. The White Dress Project is a group that I really like, and I think it's so comforting to know that you're not the only person experiencing these symptoms, and it destigmatizes what you're going through. So I really think, finding a therapist, finding support, finding a community around this is really, really important and can help you, just feel better mentally about what's going on.
Mhm. Oh, thank you so much. That was very tactical, and I love that you said that our providers are consultants to our bodies, but we do live in these beautiful, amazing bodies 24 hours a day, 7 days a week, 365 days in a year. So we have the expertise. We have to stand in our power and be able to articulate that in those moments where we are not feeling heard or seen. So thank you so much for giving us that. I know that there are so many women that are watching that are rewinding to take notes and to capture all of the information, because this has been such a fantastic discussion. I mean, I am taking so many mental notes that I want to share with my girlfriends and that I want to be able to utilize as I go into my appointments going forward. And thank you, Healthy Women, again, for bringing together such a powerful panel and discussion about fibroids. The goal at Healthy Women is that no one feels alone during their health journey. And so we really hope this information will be helpful to those who are living with fibroids. You are not alone, and you need to know that. And check out our amazing practitioners. They are evidence that they're out there. So I just want to say that as well. Please continue to visit healthywomen.org for all of your women's health needs, and check out my podcast, The Great Girlfriends, wherever you stream. Candy, Dr. Jackson, Dr. Lippman, thank you so, so very much for just your availability to this conversation, and to every single woman who will listen to this and feel so much power afterwards. Thank you.